Oh, over here. Sorry, I should have. The stairs are over here for presenters, and then you come in through the curtain. My bad.
All right. Good morning, everyone. I like to lead by modeling. That stairs are over there. It's really good to be back home. As it was just said, I received my undergrad degree from University of Oregon, and so it's just nice to be back home. When I walked into the room, it was so nice to see all of the dedication and the commitment that you all have by showing up on a Friday to really begin to, continue to be a community of practice and to be thought partners around how we really begin to work upstream to really stabilize our future. Children, youth, and families are our future. So I'm just gonna kind of do a level set and provide some foundation of why we're here today. Youth substance use disorder is on the rise in Oregon, and OHA is working to change that by walking alongside of you all, walking alongside of community, and walking alongside of youth and families to really begin to bring meaningful solutions to the issue of substance use. At OHA, we have a vision to bridge the gap in both the mental health and substance use services. Youth behavioral health, child and family mental health, we recognize that mental health is a national emergency. Oregon youth have experienced an increase in need of services due to depression, anxiety, trauma, loneliness, suicide, ideation, and so much more. As we think about what our children and youth and families have gone through in the pandemic and in this current phase, we are only beginning to scratch the surface in terms of what the long-lasting impacts are. And it's important for us to, again, really be innovative and creative in thinking of how do we really make a shift and a dent and a change in the interventions and the solutions and the strategies that we're moving forward. 75% of people getting treatment for behavioral health disorders started their first treatment before the age of 18. I just want us to take a minute and think about that. And honestly, it's probably not surprising because I'm sure that all of you have a personal story, whether it's specific to a loved one, a family member, or a close friend. Every dollar that we are investing in youth services can head off much more pressure on the behavioral health system. Suicide continues to be one of the leading causes of death among our youth. Recently, data from the Centers for Disease Control and Prevention indicate that 2021 was the third consecutive year of a decrease in youth suicide fatalities in Oregon. But gains have not been universal, and I'm sure for all of you this is not going to be a surprise. Black and brown communities and other communities of color are still seeing staggering increased rates of suicide. The continuum of support for youth mental health services, which include prevention, outpatient therapy, intensive community-based treatment services, 24-hour psychiatric residential care, that's not all that we can rely on in, again, being able to disrupt and get upstream from the challenges and the issues as we think about our future. We need to continue to collectively look at how do we evolve our strategies and our interventions. And so it's not just one system's job or role. We can't do it alone. In 2022, over 52,000 youth and young adults received services across all mental health programs in Oregon. And of that, 4,300 were served for substance use treatment services. And this needs to change. This age group has unique needs as young people as they move into adulthood and take on their own care and supports, which are much different than older adults. Young adults have higher rates of emergency room visits, substance use, suicide ideation, and so much more as compared to younger youth and older youth. And so when we think about that critical age, we're really thinking about the ages between 12 to 24. OHA is working to expand homes for young adults to provide skills training, housing, and stabilization services. As we think about responsibility and as we think about accountability, one of the things I talk a lot about as I've been in my role for 6 months, I believe that we have to continue to be outcomes oriented and really live out what we signed up to do in terms of being held accountable to continuously make increasing changes and impact so that we can see those aims. And so what are some of those things that we're doing at OHA to respond? We're working to get resources and supports to all Oregonians who need them by, again, working closely with community partners to remove these barriers. Over the past 2 years, OHA has distributed nearly 90% of the $1.3 billion in new behavioral health investments allocated by the legislator. Workforce restoration, supported housing and services, funding to community-based behavioral health networks, this specifically attached to Measure 110. We've worked to invest in restoring our behavioral health workforce and restoring services to providers that were impacted by the pandemic. We've also worked to address the workforce challenges by providing reimbursement for student loans. We've worked to develop co-occurring disorder certification services and opportunities and pathways to reinvigorate the workforce, and so much more. We're also creating and strengthening services for young adults ages 17 to 25. We've also worked closely to be intentional around how we're working to enhance and expand and bolster school-based intervention supports in the schools for youth, children, and families as well. By providing these supports and services to young people, we can lay a foundation that's rooted in health equity and that's trauma-informed. We have to stop the harmful effects of racism, eliminate the barriers to proper care, and disrupt the birth to prison pipeline. I spoke earlier about how we have to think about this from a holistic perspective. It's important for us to not only look upstream, we also have to think about what are we doing downstream. And so we have to continue to make sure that as we move the dial forward, that we're also working, as I said earlier, and taking an equity approach. And when I talk about equity, and many of you have heard me say this before, equity, not only racial equity, we have to think about health equity, we have to think about geographic equity. And so just want to take a moment to talk a little bit about the work that we're leading in terms of health promotion. OHA is leading cross-agency and community coordination of the Oregon State Health Improvement Plan, Healthier Together Oregon. HTO is being implemented through a collaborative community leadership process to address leading health priorities for Oregonians. These include institutional bias, adversity, trauma and toxic stress, access to equitable and preventative health services, behavioral health services, and exploring and examining and disrupting the economic drivers of health, including housing, transportation, and employment. Again, we have to really work to assure that we are holding ourselves accountable and living out the value around equity. And I'm just gonna, it's Friday. For those that know me, I have a Friday filter, and can't help it. So I'm just gonna say, so as we think about equity, and as we, again, work to be honest with ourselves, as we work to hold ourselves accountable, and as you all hold OHA accountable, and as we commit to continuing to be outcomes oriented, if we are living out the value, and if we are committed to the work around equity, and you can tell I'm going down a bunny trail, look around the room. Is there diversity? So what is it that OHA needs to do better? And Chelsea Ashley, Annalise, we talk about this all the time. And I'm just gonna put it out there because, again, I expect for y'all to hold us accountable so that then the next time we show up, you're gonna see a difference. But I'm just gonna say that, again, through my Friday filter, I'm going off script. If equity is real, then this room would look different. And I say that because I feel the love in the room, and I know that I can be real. And so let me get back on script, 'cause I'm sorry. So I want to talk a little bit about prevention. OHA's approach to prevention is adapted from the CDC prevention components of a comprehensive tobacco program. It's based on school and community-based prevention, overdose prevention, and harm reduction. This includes investments by the state and local policy program interventions. We're doing data and surveillance. We're doing mass outreach. We're working through a strategic communications lens to disrupt and to provide meaningful and lasting interventions. We're working to address many factors contributing to substance use and overdose, including the effects of stigma, trauma, and racism. OHA's alcohol and drug primary prevention budget is relatively small. We have limited resources. Our annual funding is approximately $10 million, which includes funding for 36 counties and 9 federally recognized tribes. And we say this because as we continue to work to bring forward meaningful and effective and impactful strategies, it's going to take resource. And so while for some 10 million might sound like a lot, it's not. And I think that it's important that as we think about the issues that we're seeing, especially as we think about the illicit substance epidemic, and we think about the impact on adults, as we think about the impact on older adults, we have to not forget about our youth. And so I'm always talking about we need to have reciprocity and equity on the youth and young adult side as well. And so anytime that we can help move the dial to get more resources to help invest in our future, I'm always gonna take a moment to speak to that. OHA works closely with the Office of Diversity and Equity and with the Oregon Department of Education, school districts, and tribes, and alcohol and drug and prevention education programs to implement evidence-based prevention educations, policies, and practices. In May of 2022, OHA and ODE created a fentanyl and opiate response toolkit for schools. This helps support educators, administrators, school nurses, students, and families in how to better get upstream to mitigate the harmful impacts of the crisis that we see playing out in our communities and streets today. OHA's vision for equity-based behavioral health services for both youth on the mental health side and the SED side, again, is rooted in equity. One of the most critical areas of need is for culturally and linguistically specific and responsive services for providers. As I spoke to earlier, we recognize that there's a disproportionate rate of young adults and youth engaging in treatment services, whether that's at the community level, whether that's in our prevention services, as we also think about peers. How do we work to really increase the penetration rates so that then we can see the inequities and the disparities as it plays out in our data and our outcomes, so that not only dominant culture, young adults and youth are getting services. And honestly, we have to do more for all. Recent investments by the legislator have laid a foundation, but generations of historical exclusion from decision-making processes have really been detrimental. And so we have worked to be intentional around making sure that what we are working to advocate and promote and implement is truly informed by the voices of youth and young adults, by their families, by peers, by community, and by all of you. As we think about the structural issues and challenges, it's going to be important for us to continue to work in close collaboration with community-based organizations and individuals with lived experience to successfully tackle the issues of substance abuse. As I think about the workforce, as we think about the crisis and just where we're at, I know at times it's hard to really wonder, I guess I'll say is that at times, I find myself and others questioning, can we make an impact? Can we move the dial in real time? A lot of the strategies that we have on the table, they're gonna take time. And I always say that I recognize, and I know that many of you recognize, that while we're working to innovate and enhance, we have youth, young adults, and families who are suffering. And so I say that we have to move with urgency. We have to be immediate in what we do. We have to also think about short term as we're thinking about the long-term strategies that we're trying to bring forward. And this has to be rooted in both policy and service delivery. The behavioral health focus of Governor Kotek's proposed budget prioritizes prevention. It prioritizes avoidable deaths, working to bolster the workforce capacity, and working to sustain the past biennium investment. It works to decrease preventable deaths due to substance use by building out our 988 substance use continuum of care, by working to stabilize and move our efforts from Measure 110 through the behavioral health resource networks to the next phase, as well as targeted funding for enhancing our substance use disorder treatment capacity across the state of Oregon. I just want to close by saying that I was at a roundtable. The First Lady had a roundtable yesterday to really look at what can we do to really start to effectively address the issues of homelessness at the intersection of behavioral health. And what I talked about was what we've done over the last 20 years on the child and family and youth side. I talked about wraparound. I talked about a system of care approach. How do we leverage relationships? How do we work collectively to, as a system, get out of the way to not continue to be a challenge and a barrier, but how as a system are we collectively working together, leveraging relationships, and working to assure that what we propose, what we move forward, how we support, how we treat is person-centered. And so I found myself all day talking about the system of care, values, and principles. And so I want to close by just saying that, again, I love that I get to end my week in a room with you all, just thinking about your power, your commitment, the connections, and what you do is how we move the work forward. I always say that it's not about me, it's about we. It's not only on OHA. We cannot do this alone. It truly takes a village, and so thank you for ending your week with us, and today is going to be powerful, so thank you.